A very good day, my dear postgraduate students. Welcome to SNP, Short Notes in Pathology, Amyotrophic Lateral Sclerosis. And this is one of the schematic diagrams that you people should have in mind. The introduction. It is a progressive neurodegenerative disorder of the upper motor neurons. Please remember this word. And the corticospinal tract. These two are very key points which you will have to mention. There is another synonym called the Lou Gehrig's disease, which means amyotrophic lateral sclerosis. It is a rare disorder of the motor neurons and the incidence is 1.5 per 1 lakh population. But still, it is the most common motor neuron disease. The causes can be idiopathic or genetic. And there is a superb diagram you must draw. The muscle fiber is given here thematically. Skeletal muscle impairment in ALS. What happens? There is a muscular atrophy because of decreased protein synthesis, increased degradation, increased oxidative stress, and mitochondrial dysfunction. The muscle satellite cells lose their regenerative capacity. And the neuromuscular junction will be showing increase in reactive oxygen species, increase in calcium, and the inflammation, which I think will fetch us the marks. Look at this. This is a normal process wherein I am finding a central tract, there is a spinal cord, and then the lower motor neuron leading to the activity of the skeletal muscle. Paul Wick's own work. So these are all the pain pathways. See what are all the regions that are generally affected in myopathies. This is a reference. So it can be the facial, the shoulder, or it can be the skin itself, spasticity being produced, or even the saliva. There can be articular pain, cramps, and so on. So this is one, severe neck pain and the back pain. So myopathies, these can be the warning symptoms for us. This gentleman, all of you know, is Steve Hawkins, a very startling personality. Though absolutely crippled, and then he has literally taken the world to ransom by his genius. What happens over here is there can be the SORD mutation, superoxide dismutase, a mitochondrial dysfunction, RNA dysregulation, and glutamine excitotoxicity. So please remember these keywords. The other things you can just follow. You find that there can be the presynaptic region or in the region of the astrocyte. There can be the impairment of the protein synthesis. There can be a defect in the transport, and ultimately there can be a neuroinflammation, which can be primary or it can be secondary to a mutation. So this particular theme you people should remember. And remember our gentleman Steve Hawkins. And the signs and symptoms, that can be the muscle cramps. Obviously in this picture I am finding that there is a drooping of the shoulder and the wasting of the shoulder muscles. That can be muscle cramps, twitching and spasticity, gradual increase in the weakness, and this is called the winging effect of the scapula, difficulty in ambulation, speaking, swallowing, and breathing. So this is again the legend of it. Kindly go through this. This is a very beautiful one. There are different mechanisms to it. This is a little complex diagram. I do not want you to go into it. This is from nature. Nature is always complicated. But then I made it simple for you. Cellular pathology over here, it can be astrogliosis or myogliosis. Then there is a nuclear cytoplasmic transport defect. RNA metabolism is affected. Failure of the proteostasis. DNA repair is affected. Oligodendrocyte dysfunction, toxic factors can be there. Myoglobin is also affected, as is shown over here, and there can be skeletal disturbances. So this particular list, I think you people can by heart. And the diagnosis can be made mainly by means of the clinical history and the examination. Increase in the creatinine kinase, isoenzyme, CK isoenzyme, and other differential diagnosis can be the metal poisoning that has to be ruled out by history. EMG, as is shown over here, thanks to John Hopkins, there is a slowing of the nerve conduction. CK can be isoenzyme. And delivering therapeutic genetic material. So there's a rat that is sitting over here, and the theme is viral therapy has been used for it, though it is in the the research stage for amyotrophic lateral sclerosis. See what is happening over here. These are all the normal ones, the healthy ones that are shown in this picture. So it is normal. Whereas in a case of untreated cases, there can be inflammation, damage, Schwann cell proliferation, and the neutrophilic infiltration. Whereas in this case, they are introducing the virus, it is being treated, adeno-associated virus, as well as the bone marrow stem cell. So these are the various methods of treatment, but please do remember it is in the clinical stage. And this again are the symptoms: difficulty in walking, tripping and falling, slurred speech, blurred vision, excessive choking, and weakness of the limbs, muscle cramps, etc. These are the things. And the treatment can be, what are all the things? It is not totally treatable. So disease modifying agents, early tracheostomy because of the breathing difficulty. Riluzole, I do not know much about the drugs, kindly go to it if wanted. Quinine and other muscle relaxants. And finally the viral therapy that I had mentioned. These can be the modes of treatment. And the reference is one that I had given. Kindly go through it if time permits. These are all questions that will consume time, but still do your best. Go to SNP. Thank you.